when you say we're not in a good place, what would you, from your perspective, what do you think is causing? Could be some of the symptoms or some of the things that cause this?
Yeah. Well, I think the number one cause, really, Paul, is high blood pressure. I mean, we have more than half the population now, and we're talking not about kids. Kids are the fastest rising group up to the age of 18, but the slides from 18 to 85 show that close to 46%, or about 125 million Americans, are walking around with high blood pressure, and a lot of them don't know it.
My people, my people, my people, my people. Bless up to you. This is Paul, co-host of More Than Black or White. This is different. I get it. Usually, after that intro, you're going right into the episode. Today, though, I'm here because your boy messed up when we were recording. We didn't get everything. You didn't get to see our pretty faces with our guest, Dr. Don Casey. So I'm putting this intro in here just to introduce you to this episode that we're doing about heart disease. Now, listen, heart disease is an important thing for me. My family has a history of heart disease. My brothers had a heart transplant. Two of my brothers have had kidney transplants. So the medication and how we manage heart disease is important for me to know so I can have a long life. And it's important to know because this is a major issue in our society. A lot of people die of heart disease. A lot of people have high blood pressure and they don't even realize it. So what we're doing in this episode with Dr. Casey is, you'll see when you watch this episode, this dude is a gem. So grateful that I was introduced to him through my family, and so grateful that he was able to be here on the episode. I want to put a disclaimer out here. The episode's got a lot of slides and talking. I mean, that's what we do. It's important. So grab a piece of paper, grab a pen, take some notes, and like, share, and subscribe, because if you know someone with heart disease, this is a very important episode for them to listen to. So without any further ado, welcome to the episode.
Everyone, Don is listen, he's a member of various committees. He's associate professor of internal medicine, a past president of the American College of Medical Quality. He's got, Don, how many studies have you been involved in right now? Or citations? Was it 60,000 or what was that?
On Super Bowl night, I passed 60,000.
Yeah, 60,000 citations and studies. So my guys put in the work. If I recall what you said before, like you were the head of a couple hospitals of Atlantic Health, or one of the heads of
Atlantic Health out in New Jersey and Catholic Healthcare Partners in Cincinnati.
yeah, blessings, man. And you're the principal and founder of Improving Patient Outcomes for Health, IPO4 Health. So really excited to have you on, man.
No, it's just a pleasure to be here. I love being out in New Jersey. So happy I ran into you in Carlisle, and we had a great time. So just going along, being me, that's it.
Yeah, what a beautiful thing that is, man. My family speaks very highly of you, so I'm like, oh, this guy, I knew he was good when I first met
I
him.
love your family.
The reason why this topic means a lot to me is like our family suffers from heart disease and kidney disease. And there's a lot, heart disease is rising and has been a major issue for a majority of our population. So Don, so for everyone, for our podcast today, Don's got some slides. We're gonna go into some slides, back and forth in slides, and really get to know a little bit more from Don's perspective and wisdom about heart disease, about vascular disease. And B and I are gonna be here just to, because, like, listen, this dude is extremely intelligent and wise. So Brian and I are here going to be representative of you all listening. So if there's certain things that we have a question on, then we're going to ask Don and get into it. So without any further ado, we talked about how the heart disease is major. So Don, I want to bring up this first slide that you presented to us, and can you take us through, and actually, can you see that slide, everybody?
Oh yeah.
Okay, cool.
Mhm.
Don, when you talked, when you shared some insights with us on this slide, can you share with the audience what we're looking at here and the reason why we want to look at this first?
Yeah, this came out last August in Journal of American Medical Association, Paul, and it's pretty simple. You look at that graph on the left side, deaths due to medical causes. Those are the top five, pretty much, in the country when you add them all up. So I put them together on purpose, and as you can see, those trends are rising, as you pointed out,
Yeah.
and they're all related. We'll talk about that. But diabetes, hypertensive diseases, neurologic diseases, kidney failure, and heart failure. So that's just to show you that we're not in a good place right now.
Uh, d- Don, what is I was about to say the Don Dada. Um, Don, what do you attribute that to? With because I when you say we're not in a good place, what would you, from your perspective, what do you think is causing? Could be some of the symptoms or some of the things that causing this?
Yeah. Well, I think the number one cause, really, Paul, is high blood pressure. I mean, we have more than half the population now, and we're talking not about kids. Kids are the fastest rising group up to the age of 18. But the slides from 18 to 85 show that close to 46%, or about 125 million Americans, are walking around with high blood pressure, and a lot of them don't know it. And that equals out across all gender and racial categories in terms of the prevalence of it. Obviously, higher in some of the populations like the African American population, but still, it's going up for everyone.
Mhm.
And that to me is it's not the only thing because as you'll see, we've got a number of other risk factors for cardiovascular disease, but that is the number one cause. And I just don't think we're doing a good job. We think that if we use the new targets for blood pressure from the Heart Association,
Mhm.
which we'll talk about, that probably only about 30 to 35% of people have their blood pressure adequately controlled.
Yeah. 30 to
So you tell me
35%.
if that helps explain 35% probably. Yep.
What? What the heck? All right, so I gotta ask because, and it may be a projection. I know for me, um, I was very resistant to go see my doctor about blood pressure issues. Okay,
Till you
because
met
for
me, right?
it's exactly. So yeah, man. But I remember, I was like, it's not that big a deal. I remember my mom was always on medication, like 3 or 4 bottles and stuff, of pills, and I just was like, man, it's not that big a deal until like I finally got my exam, and they were like, you got high blood pressure. So what would you say, is people's what could be a resistance that people experience, uh that prevents them from checking on their blood pressure?
Well, that's a great question, and I hope to spend some time in this podcast going
Mhm.
through that. But I will say, off the top of my head, number one, many people aren't even aware they have it, and that's because of the way we think about it. We think, what's your blood pressure? Well, on last September when I was in the doctor's office, it was 135, and he said everything was fine. And so, my blood pressure is 135. Well, you know as well as I do, blood pressure is continuous and it's all day long and all night. And so you can't just say it's this, that, and the other then. So we're locked into this idea that of what counts in terms of how we even know we have high blood pressure. There are other factors, such as the fact that the rising tide of obesity, which fortunately now is starting to curve down because of some of these new medications, but that's a big factor. More diabetics, although I saw some data today that I posted on LinkedIn now saying that the good news about diabetes is fewer people are dying from it because we have better therapies, but that doesn't
Yeah.
mean we can't stop people from getting it. And
Mhm.
then there are other common sense things we'll go through, the lifestyle modifications that we aren't paying enough attention to. So,
Yeah.
and not enough people exercise and, you know, people drink alcohol and maybe salt their food, so there's a variety of different things. And in the end, it's really, and environmental factors where you live,
Yeah.
So I think you got to take all this into account. It's a complicated thing. It isn't okay. You're 141. Here's a pill. We'll see you in a year. That those days are over.
Mm,
They have to
damn.
be. Yeah.
Got it. So it's like more control, having people help
More
being able.
involvement of yourself, personalized involvement of yourself and control of it. You know, I got my cuff right here, and I measure my blood pressure at home, and it goes on my watch, and I know what's going on, and I go to the doctor with it. You know, so that not everyone can afford that, but these are the types of things that you should be doing
Yep.
for yourself, and we'll go through some of those steps as we move along.
Yeah, and I want to I appreciate that because I want to talk to and I know we got to slide on some of the factors. I want to let's check in on like you have here the first steps to successful high blood pressure control. Can you tell us what we're looking at on this slide?
Well, the things have changed,
Hmm.
and there's confusion in the world about this. There's debate about whether it's 140 over 130. I mean, a lot of the science is showing really that below 130 is not high blood pressure. We used to think above 140, but there's still a lot of
What?
confusion even amongst doctors, right?
Okay.
And we'll show you a slide about this, but we gotta classify and know how that works out in the staging system. I mentioned measuring blood pressure, but it isn't something you can do easily. You got to follow a protocol. It can't just be, have a drink and a cigarette and have a full bladder and sit in this chair and here, take it out off. People put the cuff over your clothes, right? They should never do that. That's incorrect. So we're not even measuring it accurately. And then the real question is not what's my blood pressure. The larger question is what is my overall risk of what we call a major acute cardiovascular event in the next 5 years, and that's or 10 years. And that's why you got to know your numbers. And that includes other things besides your blood pressure, cholesterol, your weight, your age, all these other things roll up into cardiovascular risk. So these three things are at the core of figuring out how to take better care of yourself and understand what your goals are in terms of reducing your overall risk. That's what
Mm.
we're here for.
What is ASCVD?
Yeah, that's doctor speak for atherosclerotic cardiovascular disease, which basically means your blood vessels, the disease atherosclerosis. I hate the word hardening of the arteries because not all atherosclerosis is hard, right? Some of it's soft.
Mm.
But if you think as in terms of the way a heart attack occurs, that's the end game of having narrowed arteries from all this stress on the arteries from cholesterol, blood pressure, and the like, right?
Yeah.
So the blood vessels are actually the target organ of the body, and it gets wear and tear if you don't take care of it, just like anything else, you know.
Yep, that's the
And
truth.
that's what happens. So that's what we want to work on.
Mm, that's interesting. Like what's interesting is I was just thinking when you talk about blood measuring blood pressure accurately,
Mhm.
whenever I go see my doctor, I remember several years ago he was like, "Bring your cuff in, let me see what you're doing."
Mhm.
And I was like, "All right." He was like, "Yo, I gotta make sure the cuff is good, bro." You know what I mean? Well, he didn't say bro, but he was like, "I gotta make sure the cuff is good." And it's
Matches, right? Yeah.
right, it matches to what they're seeing. And I'm curious, I gotta ask about this since we're talking about measuring blood pressure accurately.
Yeah.
How true is it about white coat syndrome?
Well, let me say something about this.
Yeah.
This is now a validated device authorized by a group called Validate BP. So if your blood pressure cuff isn't on the list of Validate BP, you're
Mm,
not using the right cuff. You know, these old things laying around that you had 10 years ago, throw them out and get a new one because these
mm.
things now are becoming standardized, right? White coat is where you show up to the doctor's office and it's high above 130 or 140, and then you go home with your cuff and it's
Yeah.
fine, right?
Yeah. Yeah.
That's white coat.
Yeah.
You know, that's what we call it. But the point of it is measuring blood pressure at home is has a different can have a very different set of results than measuring it in healthcare settings,
Got you.
especially if they don't measure it correctly. Honestly, I go to Rush and they don't measure my blood pressure correctly either. I do it at home correctly. We'll talk about that, but
Yeah, we're
got to
gonna
get it
talk.
right.
Yeah, and I'm laughing because yo, Brian. I remember I went to the doctor's office, and when my doctor was like, "Yo, your blood pressure is crazy," because I think maybe I didn't tell you, but there was a point. It was 4 years ago. I was in the hospital. I
Excuse
did
me.
this salute. I did this uh I think Brian, I think I told you about this. I was up at a men's initiation weekend. We did this activity on anger, and I was
Mm.
throwing down the stone like "Rah, rah, rah." And I had a bad headache for that night, and then in the next day. I took my blood pressure. It was like 160 over like 120 something. And I was like, oh shit, you know what? I'm gonna hang out. I was like, no, I'm going
Yeah,
to the doctor. And ever
yeah,
since then, my doctor was like, nah, man, we need to measure your blood pressure. Now, there were some other factors we'll get into later, but when I started measuring my blood pressure, I went in and I was like, yo, I was all
mm,
happy because I went into the doctor's office, Ryan, and I did my blood pressure before, and I was like, yeah, baby. I was doing the wave. I was like, ah, Chuck, my blood pressure's great. I get into the doctor's office, it's like 139 over 101. And I'm like, what the heck? So when this nurse was like, oh, you might just be white coat syndrome, I'm thinking she's trying to make me feel better about myself. And now like I realized it's a thing, right? And I thought it was interesting because I'm really excited to talk about how we measure. However, before we get there, I want to talk to a word I heard you say, stages, right?
yeah.
Stages of blood pressure. So let's take a look at this slide and give a little education on what it
Sorry.
is,
Yeah.
what these stages are, right? So right now, you'll see the stages on the screen. Um,
And the
I know.
ACC is the College of Cardiology, and AHA is the Heart Association, but there are actually 11 professional societies who endorsed this back in 2017. So
Mhm.
this has been around for 7, 8 years. There are new guidelines coming out later this year, 25. So,
What has them
but right
changed the
now, this is
guideline?
what the standard is.
Okay, so what? So the normal is less than 120 for the systolic, and then the diastolic. Um, Doctor, can you go over for people that are watching that have heard these terms diastolic and then and systolic? Can you give a brief overview of what those numbers actually, what those terms are in relation to blood pressure, like the pressure in and out and things like this?
Yeah, so that's a good question because they're both meaningful. Systolic is the one we pay more attention to, but the systolic is the pressure initiated when the heart squeezes,
Hmm.
and the pressure at when the heart finally relaxes in each beat is the diastolic. It never goes to zero, right?
Yeah.
Because but systolic, diastolic, and that's what we listened to in the old days with stethoscopes, and now with our cuff we measure that oscillometrically, so it does it automatically. So that's why the two numbers. And
Mm.
um, and you can use what's called a mean blood pressure. I won't get into that, but that combines them, and some people like to use that too. But for the purposes of tonight, I think if you just paid attention to the top one for our discussion purposes, because that's probably the one with the best meaning in terms of a lot of the studies that are going on. Not to say diastolic isn't important, is unimportant, but if we just talked about the systolic tonight, I'd be happy if you just worried about that first.
Okay, got it.
Yeah.
So when you talk about the standards change, like how would they change? Would you say that because of the conditioning that we have in society, the normal or the guidelines for systolic increase, decrease? Like what does all that mean, man?
For the determination of high blood pressure,
Yeah.
there's a lot of research been going on the past probably 10 years starting with this study called the Sprint study at NIH. There have been others before that and after that. And now globally, it's becoming clearer that for the most part, even up to the age of 85, having a lower number and not below, let's say, 100, but down in the 125 to 115 range is good.
Hmm.
And at night, your blood pressure goes down too. So,
Yeah.
the problem is you go to the doctor and the nurse, I'll use her as an example, might measure it and say, oh, it's low or it's high or it's good. And the bottom line is that's an N of one. You got to have an N of several to make determinations. So it isn't
Yeah.
just ever based upon one reading, and it shouldn't be. But
Hmm.
I do think the the bottom line is the lower the better.
Yeah.
Not I'm below 135. The doctor said it's 135, and I'm not 140. And
Mm.
I think I've got a slide about this in a minute or two, which shows it's a gradient. So, but we'll
Um,
talk about that. So.
yeah, was that the one with the blood pressure and the cardiovascular disease risk?
Yes.
Okay,
Yeah.
cool. Um, let's go there. Let's go there. All right. And then I want us to come back to what you were talking about with uh you mentioned like there's times to measure, right?
Yes.
The blood pressure. So we're
Yeah.
gonna go into that if I can find my cursor. There
Yeah.
we go. All right.
Good.
All right. So here's the slide here when you talk about blood pressure and cardiovascular disease.
Yeah.
What
So let's
so
focus on that left. Let's focus on that left side since we're going to focus on systolic. You can see it's pretty much the same for diastolic, but focus on the x-axis showing your blood pressure moves up, your usual blood pressure, and the risk on the left goes up, as you can see geometrically. It doubles every hash. So
oh
as
yeah.
you age, your risk, the line that you're on is still tilted with to the higher blood pressure with the left side of the axis, meaning your risk of dying from heart disease. Now that doesn't include
Jesus.
kidney disease, it doesn't include brain disease, it doesn't include other things, stroke and all that, Paul, but we'll just focus on heart disease since that's the biggest one. And at every age group, you can see dramatically how lower your risk is when your blood pressure is below 120.
Mm.
So that's the point of this is that it isn't like, okay, I just got over the fence, so now I'm fine on this side of the fence. There is no fence, right?
Yeah,
So
man.
we got to understand that lower is better. Too low isn't good either, but for the most part, if you can get it lower, that's really what you want to do.
Yeah, see, this is man, this comes back to like one of the reasons Brian and I started this, and you mentioned it before, specifically the podcast, More Than Black or White, and helping people be advocates, because you mentioned in the beginning, like people got to take this on their own shoulders.
Got to.
Stop bullshitting, man. Excuse my language, Don
Mhm.
Dada. But like we curse on here every now and then. But I think it's bullcrap, man, because listen, if people and listen, I take medication, right? And there are people that I was one of them that I'm like, I'm not taking any meds. Or there's people that like, okay, I'm going to take meds and that'll address it, right? Can you talk to the consequences of both ends briefly? Yeah, can you talk to the consequences of either not even going to the doctor, and we already know the consequence of that, but like the risks, and then also the risks of just taking medication and not doing anything extra to address it.
Well, the first thing we should do when we get a patient who, I mean, if you're really real high, let's say you come in and you're obviously in hypertensive emergency, you got to go to the emergency room, right? And
Hmm.
if it's high persistently, you can find actually some what we call secondary causes. Some of the tumors of your adrenal gland or your kidney can cause physiologic problems that keep that blood pressure up.
Yeah.
And we got to screen for that. But those are
Yep.
usually pretty unusual, right? Most of the time, it's just regular high blood pressure, which is not to say we ignore that other part.
Right.
And it also depends what where your little ladder is on the risk profile, right? The younger people are going to probably be less urgent to put them on blood pressure medicines right away because, as we'll see, lifestyle modification is going to make a huge difference with lowering your blood pressure without pills. That's not to say that you should never be on medication, but to me, if there's room to move on your blood pressure, the first thing you got to work on is that lifestyle modification, not here's a pill we'll
Mm,
see in 6 months. But that's the
mm.
old way of doing it, and it's got to change.
So the Dr. Don. I want to go into a couple slides here.
Sure.
This first one is the focus on the target organ, not the end organs. Can you, because we got a lot going on this slide, man. A lot.
Well, we got a
Yeah.
lot going on this slide if you're thinking about the end organ. And by end organ, I mean your heart,
Thank you.
your kidneys, your brain, hello, and you know, poor circulation in your legs. But really, this is from Mayo Clinic, by the way,
Mhm.
that target organ is that system of blood vessels. You can see the big picture on the left of this guy.
Yeah.
And you can see what looks like ASCVD right there. That's what it looks like in live is that crappy looking blood vessel, right?
Yeah.
But you got to take care of that vascular system, right? It's not just your heart, it's not just your kidney. They're all connected, right? They
Yeah.
wouldn't exist without the blood vessels. And now we know that non-Alzheimer's dementia is very common in people whose blood pressure isn't controlled. So if that doesn't get your attention, then what else would, right?
Hey, Paul, it reminds me of the brain episode we did when we talk about that doctor, and he's like, if you have lack of blood flow, one part of your body, you have it everywhere.
B.
That's right.
Thank you, brother.
Yeah. So they just brought that up. So it's like, you're lacking it
Stroke,
in somewhere.
stroke and dementia, those two things. People don't think about dementia. Stroke obviously is the big one, right? That's when you don't want either. That's, worse than a heart attack sometimes, right?
Sure.
But all those things are connected to this blood vessel. That's what we got to focus on.
Dang, man. Wow. So yeah, B, man, Brian, thank you for that, man. Cause you just brought me back to that episode and that like the connection there, man. Because from what I'm hearing you say, Dr. Casey, is like, shoot, if the blood flow is lacking, it's gonna contribute to a lot of other things beyond just the heart. And B, I remember when we had that conversation and I was like, oh, junk. Like it shook me a little bit because I'm like, yo, I mean, my junk is, my BP is controlled now, but I'm like, man, I want to make sure that my junk is right. Right. So this is important because like even stuff like an enlarged heart, the different strokes, like, man, you know what's crazy is like, there's some guys my age, a little bit older that are stroking out right now. Like one of the dudes
Correct.
in my men's circle, the dude's 40, 44, young
Mhm.
40s. He had a stroke.
Well, Paul,
I'm
let me say something more because it's not just blood pressure here. So that blood vessel is also influenced by cholesterol, your age. Diabetes makes that grow a lot faster, right?
mm,
So that's what all these risk factors are that you got to play on all of them at once, right? This isn't just one thing. That's the problem right now. We have, oh, your cholesterol's over here. Oh, you got diabetes over here. Oh, you got high blood pressure here. Oh, you got to check your kidney for albumin, right?
mm,
And you got to do all these things at once because
yeah,
those things are all going to influence that blood vessel. And so you got to take care of it, right? It's like not polishing or shining your car for 10 years, right? You got to keep those blood vessels clean, right? As much as you can. I mean, getting old, they grow in too, but not nearly as fast as if you don't have these things under control.
right.
So
So, Doc, you have you have a slide that goes into treatment and prevention. So are these some of the things that we do to help with the blood vessel? I'm gonna share this slide rather than me just
Yeah,
talking. Let me share this
sure.
piece right here. Um, because I think this is very interesting. And doctor, we really appreciate your time. So I want to go over this, then go over how people can measure correctly. And then we'll start to wrap. And
Sure.
then yeah, but so what we're looking at here, I was fascinated by this slide when I read your study, and then also when I watched the video, which by the way, everyone, we're going to put in the show notes. You're welcome. Um, can you talk to the folks right here about what we're seeing, and specifically what we're seeing on the main screen, but then talk if you can also explain what's happening on the right side of the screen, please.
Let's read the top line.
Hmm.
Heart Association, College of Cardiology, plus nine other groups, and there's diabetes and kidney in there too, right? So
Yeah.
all of them are saying what? Guideline directed non pharmacologic interventions. No offense to your grandmother, but these came from science,
Hmm.
right? And for treatment and prevention of high blood pressure, right? So if you don't have it, these things help you too. Now, on the left side, you see six things. And what does 1A mean? 1A means that there are massive amounts of data, studies, science, evidence that show you without question that if you influence each one of these, it's going to have an effect. And your other question, the effect is on the right side, right? So
Yeah.
exercise, and it can be aerobic, it can be resistance, it can be isometric. All these have benefits, right? But if you look at those three boxes, three sets of boxes to the right of those, that first big one, each of those has an independent effect on lowering your blood pressure. Hello,
Mm.
right? And the same thing for the others. There's six of them. I think I think the Heart Association now was calling them Simple Seven, and now there's the I'm thinking of the NCAA's now. It's not the Elite Eight, but it's the eight now because sleep is in there and kidneys, right? But
Yo, Doc, we got a couple more weeks for the tournament, man. We're
I
gonna get
know
back.
I'm
We're gonna
gearing
have to
up.
hang out, man. We're gonna have to hang out for the tourney, man.
But alcohol intake, you don't have to quit, but reduce it. Weight loss, which is actually becoming something that more people are getting their arms around, so to speak.
Yeah,
A
I like
healthy
what you did there.
diet, which means less saturated fat and all this other stuff. There are a lot of ways to do it, but you know what
Yeah,
I'm talking about.
yeah.
Reducing your sodium, not pouring it on. I mean, I got to put it on my Jersey corn, but that's about it.
Hey, but hold on, Doc. What about sea salt? Like there's pink. There's like I hear about sea salt.
Salt
Not
is
like that.
salt, man. Salt is
Got you.
salt, you
Okay.
know. And then actually potassium is good for you. So that actually independently has blood pressure lowering. So all these things can lower your blood pressure. Each one of them has that effect. So it isn't like you do one and you just get 4 millimeters. You can get more out of these lifestyles, right? And that takes a lot of work. The average person, they're lucky if they follow one of these.
Yep.
Yeah.
But so what you're saying? Oh, I'm sorry, Brian. You say something?
No, I was agreeing with him. Yeah.
Yeah, man,
Look,
and B, this is up your alley, bro. Because yo, Brian, this dude is a mastermind with the nutrition and just like even some things I learned from B. I'm like, yo, this is what's up. Um, so I just want to make sure I'm clear on something that you're saying. So if someone, say for example, does dynamic resistance and they also are only having two drinks now, wait, hold on, I just want to make sure I'm reading this right. Um, less than two drinks daily, right?
Yeah, 10 to 14 is the max. Now we're getting the cancer scare on there too, but
Oh man,
for the most part, no, three, four cocktails a night, right?
got you. All
So
right, so
that's what we're talking about.
just for my
A
clarity, my personal.
couple fingers of scotch, that's good.
Oh, oh, that's all you had to tell your boy. But listen, man, it's a wrap. I do want to ask a couple things before we go on, right? Because I think there's a couple of things that I've heard, like so for example, the isometric exercise. I think that's really interesting. So something like a wall squat, a plank, things like that. Those are things like, and just for people that know, if you're unfamiliar with what the isometric means, it's basically like there's no change in the muscle length. So it's not expanding or contracting, it's just there. So like if you're just pushing against the wall, if you're in your push-up position, or like you're hanging or you're pulling and you're holding, that's an isometric exercise. B, did I do a good job explaining that?
Yeah, you did good. You should be a trainer.
I'm gonna look at it. I'm gonna think about it. But so, and also one of the things like potassium.
Hmm.
So, what are some like, well, I think people can go and find that out for themselves, but I think it's very
Yeah.
important to look at like these types of potassium. And also, what's the scoop with the DASH diet? I tried it and it sucked. Like, what does that
You
mean?
know,
Like,
it's one diet. They're Mediterranean diets. There's, anything that's going to help your metabolism. If you're on statins, for example, you gotta watch, what you're eating there. But for the
mhm.
most diabetes, you gotta watch your, too much carbohydrates. But if you're trying to lose weight, you want to use one of the protein diets, that works too. I think it mixes in with weight loss and sodium. It's kind of a hybrid, right?
Y- It's very interesting, man. You meant, and that's one of the reasons I wanted to bring that up, right? Because there's a lot of diets in here. Brian and I even did an episode on the metabolic type diet, right? And
Mhm.
really finding out what aligns for the person's body. And for me and my blood pressure, I like treat myself as an experiment, especially recently. So I've been eating and drinking some different things. Like I did a detox last week in honor of my brother. And one of the things I noticed, like when there was a couple days I had just steak, eggs, and avocado. Like I had 2 meals a day. It was those two. I noticed my blood pressure was nice. Like I'm talking, it was 122 over 79. Then I noticed when I was drinking, I'm curious for you about beet juice. Like Brian and I have talked about
Nitric oxide.
yeah, nitric
Mhm.
oxide. Um, I know beets are very good for that because I had a beet. It was a beet. What did I have in that? I don't know. It was beets and ginger and something else. Oh, beets and red
Mhm.
grapes. And when I was
Mhm.
drinking that for some days, my blood pressure was great. It was like, I think it was at one
Mhm.
point it was 119 over 78.
Mhm. Mhm. Mhm.
So any thoughts, like any from you and Brian, like any thoughts on some things that like little hacks that may not be on this that people could take away?
I'll let Brian talk.
Yeah, I look at this and I see like whole grains. With my background, you're the expert, so correct me if I'm wrong, but like a lot of that like grains and like gluten, people have issues to that. So I would be careful with that, especially if it's non-organic. Like they spray a lot of crops with like glyphosate, which is one of the main ingredients in Roundup, and they spray it on vegetables as well. And I've read a ton of research on. Actually, you talk about RFK. He's done a lot of research going after, Monsanto and glyphosate companies, and that
Mhm.
will jack up your organs. They've been showing studies for raising blood pressure, uh, eating grains, whole grains with glyphosate sprayed on. So it's not in my background. It's not really like the calories or the quantity of food. It's the quality of food.
Yeah.
So like a lot of people think, oh, red meat's really bad for you. Well, it depends. The ways commercial raised cows are raised these days, they don't raise them by how many they are. They raise them by how much they weigh. So they literally feed it. I've been on these lots. So they feed it like cement dust, sawdust, feces, urine, sewage, injected with
Mhm.
soy and antibiotics, and that's what we put in ourselves.
Mm,
And then all of a sudden, like we start to have all these issues, and everyone's like, "Oh, red meat's bad for you." So it all
Mhm.
depends on the quality of food, in my opinion, which can cause a lot of issues as well. So
yeah.
that's my two cents.
I got another
That's
secret
thanks,
about
B.
that too, because she's called my wife. She is she's into all this, and she just tells me what to eat, and I try to, you know. But
So
she's good. She's all over this. I mean, it's great.
so
Great.
I wanna talk to something because Brian and I we like it's more than black or white. So it's more than like this or
Mhm.
that. Like there's a spectrum, right? So I'm curious, like. outside of these things, like how important is relationships in regards to how we manage blood pressure? Because like I know like for you two are married, right? And
Hmm.
I was even joking around with Brian, like, actually, perfect scenario. We were gonna do the podcast last Thursday, and Brian was like, "Yeah." I was like, "Brian, it's your birthday." He's like, "Yeah, I'm good." And then he was like, "Nah, man, my wife is gonna whoop my tuchus if I record on thing." And I'm like, "Yo, bless up to her because she loves you, right? She loves you." So I think I'm curious, like, how important is environment and having someone that cares? Because we're gonna get to it. You mentioned team. How important is that when we're talking about this, man? I'm gonna stop sharing for a little bit.
Yeah, no, that I think it's a great question. I think, if you remember on that slide I told you about the 1A, so those are science. The stuff about stress, right, and getting worked up and all that, I think it's less scientific in terms of don't do this or don't do that, but I do think that with the advent of home blood pressure monitoring, you got to learn your own cycles. Do you know what I'm saying? Like you
Yeah.
sound like you're tuned into it, Paul. And I tell people it isn't one thing, right? People always think, gee, if I don't do X, then my blood pressure will be fine. No. So you gotta, just you gotta chill out. And I think when you start seeing your blood pressure go up in certain situations, learning how to chill a little bit more, so I think it's getting sleep is one of the things that actually isn't on that list that's going to be on that list. You got to get a good night's sleep. And a lot of people have
Talk
sleep
to him.
apnea. And if you treat your sleep apnea, that can help too. So that's one thing we didn't have that in the guidelines, but now we got the science on that. So you'll see that in the new guidelines.
Yeah,
Yeah.
So those things
nice.
are, yeah,
Remember the brain
yeah,
episode too? The guy was saying people that have sleep apnea have about a six-fold more of getting dementia and Alzheimer's in the future too, because it cuts off oxygen to the brain. I thought
that's
that was
right.
pretty interesting.
Yep,
Yeah,
yep.
listen, and you know what's wild, man? Because when I guess I had mild sleep apnea, but I lost a lot of weight. Like I forgot. Like actually, Liz was showing me a video from Carl's wedding, or she was telling me about a video she had from Carl's wedding, and her husband was like, "Who is that guy?" And she was like, "That's Paul." And I was like, I forgot. I was like 255 at one
Wow.
point.
Hmm.
And it was a problem because I was walking upstairs, I was like, I was like, yo, man. And like, my wife at the time, my former wife, she was like, yo, I couldn't sleep. You were snoring. I didn't even know if you were breathing.
Hmm.
So I want people to recognize, like, and this is part, I think, of a relationship. You have somebody in your life that loves you. At least they could bring awareness to some of this stuff. Because
Hmm.
some people may be going through life, they don't even realize they got sleep apnea and they just wake up like, yo, man, I don't know why I'm so tired. Because you didn't sleep,
Yeah,
you didn't get any oxygen, bro.
yeah,
Or sis. It's
Yeah.
what it is, man.
yeah.
Um, Listen, we're gonna eventually get, and I swear to goodness, we're gonna do our best to be out of here in like five, like maybe 10
No
minutes.
worries. No worries.
Um, Hey, listen, I want Brian's wife getting mad at me, man, because listen, he's got duties at home, so I'm like, she is not beating me up. So look, but I want to get to one of the things I really appreciate about what you were talking about in your study and on the video was this blueprint for change.
Hmm.
So can we go through that? I'm going to bring up a slide. We're going to go through this and then we're going to talk to the people about how you measure and then we'll start to wrap.
Yeah.
So we talk about the golden triangle and the space for change. Where's my cursor? I'll get it right one day, guys. There it is. So
Yeah.
here we're looking at this slide here. Tell us about what we're looking at here, and just we'll put this up for a little bit. But like, what are some of the things that you want us to really focus on when it comes to the blueprint for change and really managing this our
Mhm.
vascular disease?
I actually messed this slide up. There should be a star next to shared decision making. Um, but let me say that what we've talked about is the why and the what. We haven't talked about the how.
Mm.
And so what we believe now is if you add in that we're talking not just about one thing anymore, but we're talking about your vascular system that's affected by all these things at once, It's not something that a 15-minute office visit is going to get dealt with pretty well. And we know that, and the doctors know that too, right? It takes a lot, and especially if you got complexities. So let's start with the one that is, and these all come out of the newer guidelines. So we know that these things actually are big priorities that fit together. You can't do one. Let's start with social drivers of health. I mentioned my brothers and sisters on the south side and west side of Chicago who have had proven by zip code studies that if you are from those areas and you live there and stay there, you got about a 15-year cut right off your life, right?
Damn.
And so, but you got to think about that environment, right? Because I mean, there are obviously healthcare disparities. We know that, right? There's economic disadvantage. There are
Yeah.
food deserts, right?
Yeah.
There's no place to walk at night, right?
Yeah.
You understand what I'm saying.
I do.
And so and then people are working. Some of them are working 2, 3 jobs to put their kids through school, right? They're really beating themselves up, right?
Yeah.
So you come into this with all that stuff I put on the slide, and you say, "Well, here, go do that." Hand it to the person. They're going to look at you cross-eyed, right?
Right.
And so we got to start with what is on your plate, right?
Mm.
Are you worried about buying healthy food, or are you worried about paying your heating bill, which I hope is about to end around here? But I mean, it hasn't been the warmest winter. You understand all these things. I can't get a ride to the doctor, right? All these things play in, right?
Yeah.
So we gotta start with that, right?
Yeah.
What are the realities of your life, and what can we do today to prioritize at least trying to fix one of these or helping you fix one of them, right?
Right.
Because we know that the how isn't going to get done unless we start there. But the other thing, and lifestyle modification is a big part of that, so I put that up there. But the other thing is that's shared decision making, sitting down and saying, now here's what I think is important. What do you think? Right? We're having a conversation, not here's a prescription, see you in 3 months, right? Or go see this dietitian, right? I mean, I'm being unfair to my brother, and I practiced general internal medicine for 20 years, so
Yeah.
I know what it's like to be in that office. And
Mm.
it's hard to get all these things down, especially when you're also talking about other risk factors, right?
Yeah.
So that shared decision making wraps around the social drivers of health. And now we know, and this is evolving, that you need a team to do it,
Yeah.
right?
Yep.
And not everyone even has access to a team, right? But if you need to have a dietitian, right? You need to have a sleep study.
Yeah.
You need to have someone talk to you about non-pharmacologic treatments for high blood pressure, right?
Yeah.
You got to have you got to get help with a prior authorization for your new medication to lose weight, because some of them that aren't covered are too expensive out of pocket, right? Yada 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 yada, right? And that's the bad news is it's complicated.
Yeah.
The good news is if you get all that right, it's going to make a big difference. And we know that the health system, which is let's put it this way: when you're sick, that works, right?
Yeah.
But Brian, you could probably talk about this too. It's not a health system in the sense of the word. It's a disease system, right?
Yeah.
Yeah.
So we know there are studies now that show when you put these things together into a system, and they've done it even in Medicaid
Yeah.
across the country. There's some groups called federally qualified health centers, which are primarily community resources of integrated healthcare, where you can go, like over here near the VA, to Miles Square, where I started my residency
Mhm.
in the neighborhood, right?
Yeah.
And get really good gold star care on Medicaid, right?
Yeah.
Because they got those systems in place. Now, not true all over the place, but that when that occurs together in an organized system, you have a much better chance of getting healthy, right?
Mm. Yep.
And that's the key, right? We're working on that system. It's not like we don't have it. We don't have it for everyone right now. So that's the golden triangle. Those three
Yeah.
things fit together: the social determinants, the shared decision making, and the team based care. You put those together, there's evidence that you're gonna live longer.
Yeah. It's very
So we got to
interesting,
get
man.
real, you know.
Yeah, man. I really appreciate what you say, especially when it comes to people of color, right? Like people of African descent, man, like heart disease is a problem. And I really appreciate you acknowledging like some of the social and environmental factors that can contribute because there's the thing why I think it's yeah, I'm just like almost like flustered because there's a survival mentality to, and you mentioned it like, I just need to freaking pay my bill. I'm gonna
Hmm.
go get this Wendy's double stack, like two of them for three, for whatever, like
Because
because
I'm
it's
on
in
break, right?
I'm
I'm
on
on my
break,
break, right? Yeah,
right?
right.
And then to Brian's point, like, hey, eat red meat, but they're like, this is red meat, but like, yo, is this really right? So, and even like when it comes to stress factors, like I know for me, one of the things that contributed to the heavy weight and also the high blood pressure was alcohol consumption,
Hmm.
right? And even when, and that was a stress reliever for me because that's what I knew. So you talking about the shared decision making and then having a team, I hope that at some point we can become a health system rather than a disease system.
We're getting there.
Slow and steady, like
As
a
long as
turtle,
I'm
right?
around, we're gonna get there.
That's why you the man. That's why I call you the Don Casey. I know. I'll take it on. I'll take it on, Don. I'll take it. Hey, hey.
I'm in trouble now.
You can blame it on me. You can blame it on me, man. Look, but hey, I want to touch base now. Before we start wrapping up, and like and you bless us with some last words. I want to talk to what are some things that people can look at when it comes, or what are some key things when it comes to measuring our blood pressure? Like, what are some things we want to be aware of? To make sure that we're doing this correctly. So can you take a couple minutes and just talk to what are some things that we want to make sure people are aware of when it comes to measuring their
Get a
blood pressure?
validated device. This one's the Omron. I think it's about 65, 70. They're
Okay,
trying to get Medicare and commercial insurers to cover this for people.
that's good.
I don't
Okay,
know if I don't know why large employers wouldn't just give each one of their employees one of these, but once you have it, this means that this is validated. We know it's going to give you the correct readings, and you got to use it right. It's got to be fitted correctly because
right,
your cuff size can vary. But this comes from the Target BP, which is a combination of project been going on for about 10 years between the Heart Association and AMA. Measure it correctly, and this you can find this online. And I know you're going to give the viewers access to this, but if you just look up Target BP online, it'll give you something you can print out. You follow it, right? It's pretty obvious. Don't avoid caffeine, cigarettes, stimulants. Wait at least 30 minutes after a meal. Empty your bladder. If you're on medication, take your blood pressure before you take your medicine, right? Be
right,
quiet for a while, sit quietly. And I have trouble doing that for 5 minutes, but put
me
your
too.
arm out straight. Don't put any clothes on. Keep your feet on the floor. You got to do these right. And if you do it consistently, then you know you're going to get an accurate measurement. And that's not something even when you go into health systems. How many times have they just taken your shirt and put it around your shirt, right?
Right,
So, but that they're not taking it for this reason. When you're doing it for high stakes, you're going to do it right with your validated device at home,
and so it
and
is.
everyone ought to be doing it.
Yeah, there's some
Just think of
things.
that. Just think back to that picture
Yeah,
of the guy with the blood vessels and all that, and worry mostly about your brain and your kidneys too, right? So that's the thing,
yeah, this one here. Yeah,
just keep that in mind. That's what you're working on, right? And that takes. I love that visual.
yeah, that visual is strong, man.
Yeah.
I tell you what, like I'm looking at this, and there's some things that I recognize I'm doing incorrectly.
Mhm.
uh which is very interesting. Like for me, when I go take my blood pressure, I rarely just sit 5 minutes before I take it.
Gotta
Rarely.
sit.
If I actually I'm gonna be, I have yet to do it.
Mhm.
And then I usually do two measurements. Um, and the thing is, I'm gonna tell you, I don't think it's 1 minute apart. Like I'll see something, I'm like, okay, good.
Well, start with doing it, a little more time to rest and take it easy.
Yeah.
And then, once usually is okay. Sometimes it's a little high. You can switch arms too.
Mm.
That's a good thing.
Yeah, and I know it
But
says no stimulants, so I know it's probably still
yeah,
not good to smoke a joint while I'm taking my blood
well,
pressure.
no,
Probably not a good idea.
nothing.
Nothing. Okay, I'm
But
just checking.
I've got so everything comes up on my phone right
Yeah.
here, right? And
Yes.
I can pull it up, pretty easily. And then I take it into my doctor. Just give me one sec here. Like, it shows me that. You can see
Yup.
that.
Yes,
And
man.
then,
Yes.
my diary, you know, as like, let's see, sorry, uh, the trends here. Yeah, right. So
That's
see, it's got
huge.
it all right there,
That's huge. That's
and
big
I can
time,
download
man.
it into Excel and this, that, and the other. So I bring that with me, and I take it and show it to the doctor, and then we have shared decision making after that, right?
It's cool.
Listen,
I
and
think
that's what. Oh,
hold
go
people
ahead, Brian.
accountable. It's a good way to hold people more accountable. They have something to measure. People are competitive, right? So it's good to, they want to keep that low.
Yeah,
It's
man.
calling taking care of me, right?
Yeah,
If I don't do it, no one else is going to do it, right?
exactly. Yeah,
Right. Exactly.
So,
That's the key piece. And listen, I think that's and the accountability you're talking about, B. That's that team. That's the team, right? Because I know for me, when my doctor was like, "Hey, man, I want to know what your blood pressure is, man. You gotta." Especially we have through Atlantic Health Systems, we have an app where I can communicate with them on a regular. So once a week, it's like, "Hey, man, here's my blood pressure." So by the time I go see him twice a year, if I gotta see him more, I'll see him more. But at least he knows where I am. So he's always like, okay, well, I saw this was going. What's going on here? If it's high, he's like, what's going on? Everything all right? Like, okay, hey man, actually it's not. I'm stressed, right? So it's a way that accountability helps to bring more awareness, especially if it's a provider that you care about. But the thing is too, and Brian, you and I have talked about this many times. It's going to be tough for a doctor to care about you if you don't care about yourself.
sure.
You know what I'm
Got
saying? Like,
got to meet them halfway.
you
You
gotta
know.
meet him halfway. B, how
Yeah,
many times have we talked about that, Brian?
yeah.
Shoot, bro.
No, I have a after I had a little epiphany like listening to you, Dr. Don. It was
mhm.
I have I did a little. I mean, with my research, and correct me if I'm wrong, that about 85 to 90% of people that go to the doctor for high blood pressure that comes back as idiopathic, meaning that the doctor doesn't know what's causing it. And I've always been like kind of like upset about that. I'm always like, how do you not know what's causing it? Like I drove by 20 fast food markets, I drove by 6 liquor stores, 3 smoke shops. I'm like, it's kind of obvious. But then when I hear you talking, it's like you got a 15-minute visit with your doctor. There's so much that they're doing wrong that it's almost like easier. Not, I wouldn't say easier like it being a lazy. I'm not in a lazy way, but it's like they're not going to address all these things. Like I'm thinking about like the South Side of Chicago and the other parts where they don't have the access to almost like better themselves. So it's easier to put them on a prescription to at least extend their life.
Mm.
So that was
Well,
eye.
we try really hard to improve access, and we give, people access, but, as I said, it's hard for some people who have many, many different constraints to just go to the doctor, right? So
Mm.
Yeah,
we're working on that, and I think you're right. I think people get this has always been a problem. Like in my mind, I'm talking about the average person. What is going on here? Where is this all coming from? And the answer is you, right? It's your blood vessels go like this all the time, right?
Mm.
And so that's your blood vessels, and a lot of things in your body and affected by your brain, both
Mm.
physically and mentally, can influence that too. So it's a biological system. And if I might end, Paul, the end game here is it's not just what's my blood pressure, but what's my risk, not just of a heart problem, but kidney problem, brain problem. poor circulation in my legs, getting an amputation, right?
Mm,
What is my risk of all that? And once you line that up, Ryan, then that gets your attention a lot more than just what's my blood pressure. So if there's the last thing I would say, and Paul, you can get these online,
yeah.
and I can send you something afterward. The Prevent PREVENT calculator is online, and that you can go right on that right after this and calculate out your risk right away and compare it to the average and see what where your risk is. And that I think should be the one that gets your attention the most. How do I reduce my risk? Right.
Yes. Oh man, I'm putting that in the show notes and I'm looking at that when I get out of here because I think
Mhm.
that is important because if people fail to know what the risk is, they're going to keep doing some haphazard foolishness,
You got it.
right? If you know my risk of having a stroke is 80%, you're like, God damn, I'm putting down the 40 ounce and I'm not drinking the old fashions and I'm going to go on a walk right now.
Yeah.
You know what I
Well,
mean?
just have one old fashioned.
Yeah, listen, man. Listen, hey, man, you know I like the old fashioned Dr. Don. You know I love the things. But listen, this has been so amazing to have to connect and talk to you here. I feel like I would love to do this again at some point. And I'm curious, like if people like what's the way that people can get in contact with your work? Or I know you mentioned LinkedIn, but like
Yeah,
what does
LinkedIn
your
is the
work look like?
best.
Okay,
Follow me on LinkedIn. I post most every day and it's interesting stuff. So
cool.
you can
Okay.
follow me. Yeah.
Nice. Okay, I'm gonna hook that up. We'll put the link to his LinkedIn in the system. Brian, before we wrap up, any last words, man? Any words for Dr. Don?
Oh, that was great, man. I really appreciate you coming on here and dropping a lot of knowledge bombs. So
Listen,
I'm a big learner, and you taught me a lot today. So thank you so much.
All
hey,
right. Well, thank you guys.
yeah,
Yeah.
and Dr. Don, I
All right.
know B was loving it because whenever B's got his pen out and I see him like this,
Oh yeah, I
the
got notes, man.
bruh, I see, bro. I told Brian, what I tell you, man, right? Dr. Don, any last words for the people before we wrap?
Thank you so much. And just get that risk down.
Thank you, brother. Thank you.
All
Well,
right.
appreciate you,
Thank you.
Dr. Don Casey.
God
Thank
bless.
yes, blessings to you too. Blessings to everyone that showed up and is watching this. Hey, this is important. So if you're watching this and you know someone with heart disease or vascular disease or even diabetes, please, 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 please send this and share this to them with them. Please, man. This is their life we're talking about. And if you think this is a joke, it's not. Because if you are dealing with some stuff, like you could end up dead and your family's lost without you. So take care of your stuff. We want you here. That's why we're here. We want you to be an advocate for your health and well being. And that means you get to pay attention. Please, please. If you have any questions or you need support, Brian and I are here for you too. More than black or white at gmail.com. Please, man, this is why we do what we do. So blessings to you and thank you for showing up, Dr. Don. I love, man, there's
Thank
a
you.
lot. I love, adore, cherish you, man, for who you are and how you show up and the work you've been putting in for our health and well-being. You're amazing, man. You are
I'm on
the
it.
Don
I'm on it.
Casey. Bless up, everybody, and we're out of here.
Bye.
Peace. Peace.